is deeply connected to the rest of the body. Oral health doesn't just affect our teeth, gums, it plays a major role in our general health and quality of life. In this webinar, we will explore global burden of oral diseases, their systemic implication, preventive strategies, modern innovations, and some case examples. By the end of this session, I hope you will see oral health not as an isolated aspect of care, but as a true foundation of overall wellness. Let's start with the introduction. Oral health is not just about having a bright smile, it's much more than that. It affects how we eat, enjoy our food, how we speak and communicate, and even how we carry ourselves with confidence, and even how we talk to others. A healthy mouth influences our social interaction, self esteem, and quality of life. For example, some people become so self conscious about having a bad breath that they hesitate to communicate. But beyond these everyday aspects, health has a profound implications of our overall health. Research consistently shows strong link between oral diseases and systemic conditions. For example, gum disease has been associated with diabetes, cardiovascular diseases, respiratory infections, and even pregnancy complication. This means that what happens in the mouth can have a ripple effect throughout the entire body. So when we talk about our oral health, we are talking about overall well-being. According to the WHO organization, oral diseases affect more than 3.5 billion people worldwide. That almost half of the global population. Among these, untreated tooth decay is the single most common condition globally, surpassing even conditions like asthma and diabetes. The impact goes far beyond the mouth. Oral diseases cause pain, difficulty in eating, trouble speaking, which in turn affects the daily life, productivity, and emotional well being. Many people miss work, school because of the toothache or the dental problems. On top of that, financial burden of treatment can be significant, especially in countries where dental care is expensive, not covered by insurance. So one of the biggest challenge in the oral diseases often start silently. In the early stages, they may cause no pain at all, which leads people to ignore them eh, and then until they become severe. By then, the treatment is more complex, more expensive, and sometimes even too late to save the tooth. Dental caries. Dental caries is commonly called cavities, are one of the most widespread oral diseases. They occur when bacteria in the mouth feed on sugars from our diet and convert them into acids. These acids slowly erode the enamel, which is the hardest protective outer layer of the tooth, and form holes or cavities. If the cavities are left untreated, the decay can spread deeper into the tooth, cause infection, severe pain, and even abscess formation. In extreme cases, the infection can travel beyond the tooth and lead to systemic complications. The good news is that are entirely preventable with fluoride, good brushing, dietary control, and early detection. Gum disease. Gum diseases usually start as gingivitis, which appear as red, swollen, bleeding gums, often painless, so many people ignore it. If proper care isn't taken, these gingivitis progress into periodontitis, a more severe stage where all gums pull away from the teeth, deep pockets form. The supporting bone is gradually destroyed. Over time, this can loosen the teeth and eventually cause a tooth loss, making periodontitis one of the leading cause of the adult tooth loss worldwide. What makes gum diseases even more concerning is that It doesn't just stay in the mouth, it has a strong association with systemic health conditions, especially diabetes and cardiovascular diseases. Tooth loss is not just a cosmetic issue. It has a wide-ranging effects. It makes chewing difficult, which can limit food choices and which leads to nutrition poor nutrition intake. It can also affect the speech, clarity, and importantly the self-esteem, often impacting the social interactions and quality of life. Oral cancer, on the other hand, is one of the most serious health problems. It can be a life threatening, and its the major risk factors include tobacco consumption, alcohol consumption, and infections which is caused by human papilloma virus, which is HPV virus. Unfortunately, many cases of the oral cancers are diagnosed in advanced stages when treatment is more difficult and survival rate are lower. This highlights why public awareness, regular dental checkups, and early screening are absolutely critical in improving outcomes. The oral systemic link. Now, this is where dentistry truly meets medicine. Gum diseases and diabetes have a two-way relationship. Poor gum health makes it harder to control blood sugar levels, while uncontrolled diabetes accelerates gum diseases. Similarly, oral bacteria can travel through the bloodstream and contribute to the heart diseases by triggering inflammation in the arteries. For pregnant women, gum disease has been linked to serious complications, including preterm birth or the low birth weight babies. In elderly patients, poor oral hygiene can even increase the risk of respiratory infections such as aspiration pneumonia. Periodontitis is not just a gum problem. The bacteria and inflammation can spread throughout the bloodstream, increasing the risk of several systemic diseases. Research shows strong link with heart disease and stroke, diabetes and insulin resistant respiratory diseases, rheumatoid arthritis, neurological and gastrointestinal diseases, pregnancy complication, cancer, and chronic anemia. All of these connections clearly demonstrate that oral health is not just about the mouth, it plays a vital role in overall systemic health. Prevention in dentistry. Most oral diseases are preventable with a right care. The foundation is simple: brushing twice a day and a flossing once daily to remove the plaque. Using fluoride toothpaste and mouth rinses strengthens the enamel and prevent cavities. A balanced diet, limiting sugar intake and staying hydrated also protects the teeth. Lifestyle choice matters too. Avoid tobacco and limiting alcohol consumption reduces the risk of gum diseases and oral cancer. And of course, regular dental checkups every 6 months are essential. Scaling preventive treatments like sealants. On a large scale, community programs like school based initiatives and public health campaigns and awareness help create healthier population. So one of the most basic, effective, widely used toothbrushing method is modified Stillman technique, which is simple. Place the bristle at 45-degree angle to the gum line, partly on the tooth and partly on the gingiva. This allows the bristle to clean both teeth and gum line. So apply a gentle pressure so the bristle flex slightly into the sulcus using a to and fro motion or a rolling motion. Sweep towards the crown of the tooth. Repeat on the outer, inner and chewing surfaces. And finish with scrub the tongue behind vertical strokes behind the front tooth. And next, one of the most common question I get is whether toothpaste and mouthwash can be used together. The answer is not immediately. Most toothpaste contains fluoride, which strengthens and protects our teeth. However, if you rinse with mouthwash right after brushing, especially chlorhexidine based rinses, which is most common, it can wash away the inactive the fluorides. This reduces the protective effect of the toothpaste, which is meant to give. That's why the best practice is to wait at least 30 minutes after brushing before using a mouthwash. This way, the fluoride enough act to on your teeth. So there are some of many myths surrounding dentistry, and it's important to clear them. One common myth is that scaling loosens teeth. Many times, patients come up with their own treatment ideas, and for example, some case for cleaning. But when we recommend scaling, they immediately refuse, saying दांत उकड़ जाते और दांत लूज हो जाते. Teeth will fall out. The truth is, scaling does not loosen healthy teeth. It only removes the harmful tartar or the plaque deposits, which actually strengthens the gum and helps the teeth become healthier. And another myth is that baby teeth or the primary teeth don't matter because they eventually fall out. In reality, the primary teeth are essential for the proper jaw development, nutrition, and guiding permanent teeth into the correct position. I'll even show a short video to demonstrate how it works. This video explains the importance of primary teeth. They are essential in guiding the growth of permanent teeth, as each primary teeth holds a space for its successor. When they fall out at the right time, it allows the permanent teeth to erupt in the proper position, ensuring a healthy alignment and function. And at the last, the another, perhaps the most dangerous myth is believing that cavities can heal on their own. It's not. Unfortunately, cavities never reverse without treatment. They only worsen, leading to pain, infection, and even tooth loss if ignored. Dentistry is advancing quickly with new technologies. Digital dentistry allows us to design crowns and prosthetics with CAD/CAM technology in a single visit. And 3D printing and AI diagnostics improve precision and early detection. Minimally invasive techniques help preserve the natural teeth, and teledentistry extends care to the rural areas. Most importantly, dentists and physicians are now working together to provide truly holistic care. Let me share a few real life example cases that show how the oral health and overall health are deeply connected. The first, a diabetic patient with uncontrolled gum diseases received periodontal therapy. Within a few months, their HbA1c levels improved, showing how treating gum diseases can support diabetes control. And another, a pregnant woman with untreated gum diseases went into a premature labor. This highlights the importance of a dental checkups during pregnancy. Usually, the second trimester is the safest time for the dental treatment, as the risks are lower and the mother is more comfortable. And a chronic smoker came in with a suspicious oral lesion. After proper investigation, it was diagnosed as a premalignant lesion, which may lead to oral cancer. Because it was caught earlier, timely treatment saved his life. These cases remind us of a simple truth: oral health and general health are inseparable. So let's wrap up the key lessons. Oral health is not separate, it's deeply tied to overall health. Prevention is always cheaper and more effective than the treatment. Oral diseases are common but preventable. Every healthcare professional, dentist, physician, nurse has a role in promoting oral health. Our mouth is not separate from our body. It is the mirror of our overall health. By taking small daily steps in oral hygiene, we can prevent not just dental problem but improve our overall well-being. Thank you for being such an attentive audience. I would love to hear your experiences or questions.
Thank you, Dr. Vineetha. We have few questions in the chat box. Let me read out it for you. So the
Yeah.
first question is from Vanam Dhanush. What signs in the mouth should alert us about health problems?
Okay, like the persistent bad breath, bleeding gums, loosened teeth, or sores that don't heal, which stays for a longer period of time, that is a signal. Beginner like issues like diabetes, vitamin deficiencies, or even oral cancer. So you have to check it up before getting it worse.
And we have a question from Simran. Can you explain us about oral health for children?
Oral health for children, yeah, like you can visit dentist like at the 6 month or before the tooth erupts. You have to visit the dentist, and also like you have to do a brushing technique like rolling motion, and also avoid so much of sugar intakes.
We have another question from Amit. How is gum disease connected to heart problems?
Yeah, as I mentioned in the slide previously, the gum disease cause inflammation. This inflammation release bacteria into the bloodstream, which can contribute to the buildup of plaque in the arteries. That increases the risk of the heart attack or the stroke.
Okay, we have a question from Mega. What is the recommended gap between each teeth scaling appointment?
Uh, 6 months is usually the ideal thing. You don't have to do scaling every month, as it might cause sensitivity problem as well. It depends on your plaque buildup and the calculus buildup as well.
Okay. Abhilash is asking, can you explain HPV virus again?
HPV virus,
Yes.
like human papilloma virus.
He just wrote, can I get an explanation of HPV virus again?
Uh, okay, that's like a big, uh, a different topic out of the dentistry. Do I
Okay. Cool.
have the time of that?
So we have another question from Pranay. Does teeth grinding only happen when in stress?
Yes, like teeth grinding, which is also known as bruxism. This is most one of the cause for the like during the stress, and it is also a natural habit. Few people like at the nighttime unknowingly people grind their teeth at the night time, which cause the attrition of the anterior teeth. So to prevent that, you have to check up that like do you have this habit? If yes, you have to discontinue it because it might lead to more severe problems. Like you can use a safeguard, mouth safeguard and all. And
Okay.
stress is one of the
We have,
cause for the bruxism as well.
we have a question from Simran. What is the best way to manage tooth
Sorry,
sensitivity in the long run?
I can't hear you.
Can you hear me now?
Hello?
Yes, can you hear me now?
Yeah, yeah.
Simran is asking, what is the best way to manage tooth sensitivity in the long run?
They are like desensitizing agents. There are few desensitizing agents which can be used if there is a long term. And if still it persists, you can go for a root canal treatment like RCT, which is followed by a crown.
Okay. We have a question from Vinay. Um, are there any recommended habits after meals
Sorry.
that can you hear me
Hello?
now? Yes.
Your voice is breaking.
Is it clear now?
Yeah, yeah.
We have a question from Vinay. Are there any recommended habits after meals that can help improve and maintain oral health?
Yeah, after a meal, you have to for sure gargle your mouth, and also you have to floss. Flossing daily is necessary because the food particles which get stuck into your in between interdental areas, so you can't remove it usually while gargling. So flossing is one of the best way to do it after a meal, and twice
Okay.
fresh twice daily, like in morning and also after dinner, night at the night time before bed.
Yeah. Mega is asking, doctor, I would like to know which type of toothbrush is recommended for everyday use. Is it a soft brush or hard one?
uh the best thing is soft bristle, because hard bristles which causes the due to hard bristle usage of brush, that might cause the abfraction. It's like a term in the teeth where that might lead to a hard. The teeth might attrit as well. So it's better everyone to use a soft bristle, and they have to change their toothbrush every 6 months or a 3 month.
Teja Nair is asking, can you explain at what age we can go for orthodontic treatment?
Orthodontic treatment, the best age is during after the all the dentition has come, like usually from the uh third from 14 to 18 years is ideal age, and also depending upon the case of uh the teeth alignment, so you can go for it.
Yeah. Abhilash is asking that recently I had a scaling. After that, I'm feeling sensitivity. So, can I know why, or should I consult a doctor? Should I consult a dentist?
Actually, after a scaling, like within 1 week, getting sensitivity is a normal thing. But if it still persists, then you have to consult a dentist, or else you can use a sensitizing toothpaste.
Okay, I hope you have answered most of the questions. So, before
Okay.
we wrap the session, I would like to tell about our platform, MedWorld Expo, which made this webinar successful today. So,
Okay.
it's just 2 minutes of time.
Yeah.
Let me share my screen. So MedWorld is a unified healthcare digital platform. It is a complete ecosystem for complete healthcare. We are here to connect different kind of healthcare manufacturers, distributors, and healthcare service providers, which means doctors, medical students, and complete healthcare professionals. So the major benefits, like most of the people who joined for today's section are completely like medical students and people who are into healthcare. So I would like to mention the major benefits. Before mentioning, I would like to show our success stories. So far, we have 6,000 plus manufacturers in our platform, 6,000 plus distributors in our platform, and 5,000 plus healthcare service providers in our platform. So, as a healthcare professional, the major benefits that you will be getting through our platform would be you doctors can directly create your create your doctor profiles in our platform, and you can attend webinars, you can attend CME programs through our platform, and you can like find out the latest news and insights through our platform. You can write blogs if you wanted to, and you can create different kind of medical communities, and you can connect with new people in our platform, so that it will make you to have good connections in the health in the medical industry. And if you wanted to access different kind of medical journals or healthcare journals, our platform is the right choice for you to explore and find out the good healthcare journals. And if you wanted to have a look out for the good magazines which is in healthcare, this is one of the best opportunity for you to explore. And career advancement, we are going to start it soon. People who are in healthcare are looking for abroad opportunities. We are here to help you out for the complete process, how to start the how to apply, and how do you need to travel, how do you need to take care of things. Everything can be tracked through a career advancement program. And the major benefits that we are giving is job. If you are into healthcare and you're looking for a wonderful opportunity, so MedWorld Expo is here to explore, like give you wonderful opportunities. Like we, most of the job opportunity, like all the job opportunities will be posting over here in the healthcare sector. So it will make you to find out a right job for you. And as a doctor, as a hospital, even you can post the job opportunities in our platform. So thank you so much everybody for joining the session, and thank you so much Dr. Vineetha for your wonderful session. I hope it is went well. Thank you so much.
Yeah, thank you. Hope everyone understood about this.
Yeah, thank you.